Hi, myself Dr. Monica Mehnoth. I am here to make dentistry easy for you. Today we will discuss the topic of fundamental of tooth preparation. It has two stages, initial stage and final stage. Initial stage has 4 steps: outline form, primary resistance form, primary retention form, and convenience form. In final stages we have 5 steps: removal of any infected dentine or old restorative material, then pulp protection if indicated, secondary resistance and retention form, procedure of finishing external walls, then final procedures are cleaning, inspecting and desensitizing. So first we will talk about outline form. What is outline form? Placing the preparation margin in the position they will occupy in final preparation. So students might be thinking, why we make outline form? What factors decide outline form? Why different outline form for different tooth? So why we make outline form? To include all the decayed and demineralized part of tooth structure, demarcating the sound tooth structure from your decayed part. What factors decide outline form? So you need a quick recap of modified Case-Jordan diagram of dental caries, which include 4 factors. First is your host, which includes your tooth in oral cavity, then biofilm, which contains bacteria, and diet, which contains sugar. With time it will demineralize your tooth structure. So when a person is on high carb diet which contains sugar, these bacteria in your biofilm will feed on this sugar, and with time it will produce acid which will demineralize your tooth structure, resulting in dental caries. So how it will happen? When the person chews food, the food gets lodged into these crevices between your cusp or between your adjacent teeth in the contact areas. Then the retained food particles, these retained food particles will result in demineralization of your tooth structure. So you need to look at your radiograph where your caries are initiating, in your patent fissure areas or your proximal areas or your cervical areas. If it is initiating in your patent fissure areas, this means it will be deepest beneath your patent fissure areas. So your focus should be including all the patent fissures on your occlusal surface. If it is initiating in proximal areas, you need to include your proximal surface area in your outline form. So you got my point. If your caries are initiating at your patent fissure or your proximal areas or your cervical areas, you need to include all the decayed and demineralized tooth structure. So now, why different outline form for different tooth? This is your maxillary first molar, this is your mandibular first molar. So as you can see, the pattern of patent fissure on the occlusal surface for both the tooths are different. When you try to follow this patent fissure to make outline form, the resultant outline form for both the tooth will be different, like bat shape in maxillary first molar and plus shape in mandibular first molar. So likewise it will be different in your premolar, in your canine and incisors. And the initial depth for making outline form should be 0.2 to 0.5 on DEJ and 0.8 on root surface. Second is your primary resistance form. It is defined as preparation to withstand masticatory forces by remaining tooth structure and restoration delivered along long axis of teeth. Why we provide resistance form? To prevent the fracture of tooth structure as well as restorative material under occlusal loading. We need to provide some resistance form to the tooth structure to prevent fracture from occlusal loading. There are 6 principles. First, you need to provide box shape for adequate thickness of restorative material. Suppose if your restorative material is too thin, then it will get fracture off very easily. But if you provide adequate bulk to the restorative material, then it will withstand your occlusal forces. Second is your horizontal pulpal and gingival fluid. Why your pulpal floor should be horizontal, because when a patient chews food, the forces are directed vertically along the long axis of tooth. So there should be even distribution of forces towards the pulp of tooth. Third is restricting your buccolingual extension. Why? Because to preserve your tooth structure as much as possible. This is your occlusal surface, this is buccal, this is lingual, mesial and distal. So your outline form should be restricted to 1/5 of intercuspal distance. If it is more than 2/3 of intercuspal distance, cusp capping is indicated. Fourth is rounding off of internal line angles. Why? First we have read like we have to provide box shape, then flat pulpal floor. Now we are rounding off this angle because when a person chews food, the forces are directed along the long axis in this direction, vertical, horizontal and this oblique direction. And if we keep it like pointed, then force will get concentrated on this pointed area and it will fracture off your tooth structure in this manner, and the part of your cusp of tooth structure will get fracture off. So you need to round off your internal line angles. So what we have read, you should provide box shape, flat pulpal floor, restricting buccolingual direction and rounding off of internal line angles with adequate thickness of restorative material. Second is primary retention form, is shape or form of conventional preparation that prevents displacement or removal of restoration by tipping or lifting forces. For non-bonded restoration, means we provide some form to this restoration that will prevent displacement of restorative materials, means it is related to restorative material used. So we need to provide some bonding of this restorative material to the tooth structure that will retain our restorative material in the cavity preparation. So there are different types of restorative material like amalgam, composite and cast metal. Like amalgam provides mechanical bonding, composite provides micromechanical bonding and cast metal provides chemical bonding. So for amalgam we need to provide converging walls, because if the walls are straight or diverging, the material will get displaced easily. But when we provide converging walls, buccal and lingual walls, the molecules in this restorative material are bonded by some forces, means this particles in this restorative materials are bonded by some forces. So when we provide this convergence, it acts as a barrier in preventing displacement of restorative material. So for amalgam we provide converging walls and then it will get bonded by a mechanical bonding. In composite we use HT, which will create microporosities, which will result in increased surface area. Increased surface area means increased bonding between tooth structure and restorative material. So the microporosities will provide micromechanical bonding to the tooth structure. We also use beveling on enamel margin, which is more than 90 degrees. The structure you see here is we beveled the enamel margin for increased bonding. In cast metal restoration, we provide vertical walls or slight 2 to 5 degree divergence for easy adaptation of this restorative material in the cavity preparation. So, and we also use luting agent for the bonding between this restoration and tooth structure, which is chemical bonding. As we have read earlier, in class 2 restoration, we provide a dovetail which will aid in retention form. So dovetail increases the retention of restorative material in tooth preparation. Fourth is convenience form, means shape and form of preparation that provides for adequate observation, accessibility and ease of operation in preparing or restoration of teeth. Convenience means making it easy for you to observe every wall of the cavity and making it easy for adaptation of restorative materials in the cavity. Means you need to keep two things in mind: observation and adaptation. For this, you make diverging walls in class 2 cast restoration, making it easy for you for adaptation of restoration in cavity preparation. Likewise, you keep the gingival wall below your contact point for easy finishing and adaptation of restorative material in class 2 cavity preparation. Also, from occlusal point of view, you see that you keep a clearance of 0.5 mm from your contact point for easy adaptation and finishing of restoration.